Good afternoon, Hansi Lawson. Let's begin the warm-up session. What is the dignity of being a nurse?
Being a nurse is a noble and rewarding profession that involves caring for people's health and well-being. One of the dignities of being a nurse is respecting human dignity. Nurses respect the inherent dignity, worth, and uniqueness of every person they encounter, regardless of their health condition, culture, religion, or background. Nurses treat their patients with kindness, compassion, and empathy, and uphold their rights to privacy, autonomy, and quality care. Having a sense of purpose. Nurses have a meaningful and fulfilling career that makes a positive difference in people's lives. These are some of the dignities of being a nurse that make it a rewarding profession.
What are the skills I need to be a nurse?
To be a nurse, you need a combination of both hard skills and soft skills. Hard skills are those that are learned through training, education, or certification. Soft skills are habits or traits that enable you to work well with others. Hard skills can be acquired through formal education, such as a diploma, associate degree, or bachelor's degree in nursing, and certification or licensure exams. Soft skills include interpersonal and communication skills that are vital for building rapport and trust with patients and colleagues, and can be developed through experience, feedback, reflection, and self-improvement. However, depending on the specialty, setting, and role, one may need additional or specific skills to excel in the nursing career.
How would you deliver bad news to a patient or their family members?
It is a tough but inevitable part of the job, and I believe I have learned to navigate it effectively. I understand how hard it is to watch a loved one feel uncomfortable, so I always try to demonstrate empathy when speaking to patients' family members. I calmly explain the patient's condition and the next steps we need to take, giving them time to process that information and ask as many questions as they need. Even though the news must be upsetting, I knew I needed to be honest about the situation to manage their expectations appropriately. I would never want to give families false hope about the outcome. However, I also emphasized our medical team's commitment to providing him with the best care and treatment options available.
Describe your ability to handle high-pressure situations.
I've always done well with deadlines and thrive in a fast-paced work environment. During my time at the urgent care clinic, I have helped numerous patients with illnesses, injuries, and health crises. One particular day, a mother brought in her young child, who had been quite ill. During the intake process, the child became unresponsive, and I had to think quickly and act calmly. I immediately began checking the child's vital signs, sent the other front desk worker to get the doctor, and began cardiopulmonary resuscitation, which I continued until a physician took over. The child was ultimately revived, and my ability to act quickly using the training I had acquired was an integral part of saving that child's life.
Discuss the personal attributes that make you especially qualified as a nurse.
I am extremely detail-oriented. Whether I'm charting and keeping records, noting patient conditions, or administering medication, I always double-check my work. Efficiency is important, but not at the expense of accuracy, and I believe in removing as many barriers to accurate care as I possibly can. I'm also very observant. I tend to notice the details about patients' conditions that others miss. Whether it's a glassy look in their eye or a certain way they are clutching their abdomen, I look for and record details that may offer clues into the causes behind a patient's condition.
Your preparation time is over. Please start your OET speaking roleplay.
Hello, Mihiraa. It's good to see you again. Could you please confirm the reason for your today's visit?
Hello, Hansi. I'm here for the follow-up checkup and to monitor my blood pressure.
Thank you for your information, Mihiraa. To start, could you tell me a bit more about how you've been feeling lately, both physically and emotionally?
Well, to be honest, I'm a bit worried. My last results weren't great, and I'm concerned that my kidneys are getting worse. I've been very tired, even after a full night's sleep. It's frustrating because I'm taking the medicine, but I don't feel any better.
Thank you for sharing that with me. It's completely normal to feel this way, and your feelings are important. Let's talk about why managing your blood pressure is our main goal. Think of your kidneys as a delicate filter system with tiny blood vessels. High blood pressure is like forcing too much water through that filter too fast, which can strain and damage it over time. By controlling the pressure, we protect these filters and directly slow down any harm to your kidneys. This also gives your heart a much-needed break, reducing its workload and helping to prevent future heart problems. I want to reassure you that we have many ways to manage this together. This isn't about one single fix, but a team effort. We can adjust your treatment, keep a closer watch on your numbers, review your medications, and find lifestyle changes that work for you. You are not in this alone.
That does make sense. I know I should probably look at my diet more.
I'm glad you mentioned diet. It's a powerful tool we can use. Let's talk about some food choices that can make a real difference for your kidneys and blood pressure. The most important step is watching your salt intake, as it causes your body to retain fluid, which directly raises your blood pressure. We can also look at the amount of protein you eat. While you need some, too much can make your kidneys work harder than they need to. A simple rule is to be cautious with processed foods like frozen meals, canned soups, and deli meats, as they often contain large amounts of hidden salt and other minerals we need to monitor. Beyond food, other daily habits play a big role. Gentle, regular exercise like walking can strengthen your heart and help manage stress. Reaching and maintaining a healthy weight also takes a lot of pressure off your entire system. It's also crucial to avoid certain over-the-counter painkillers like ibuprofen or naproxen, known as NSAIDs, as they can be very hard on your kidneys. Finally, finding what helps you unwind, whether it's reading, talking to a friend, or deep breathing, can significantly help control your blood pressure. This might feel like a lot to consider. Do you have any specific concerns or questions?
I understand what you're saying. What's bothering me is wondering what could be causing the high blood pressure.
That's a very important question, and I'm glad you asked. Mihiraa, it's common to wonder why it's still high, and often it's not just one thing but a combination of factors we can look into together. For instance, the timing of your medication is crucial. Taking it at slightly different times each day can make it less effective. We already talked about salt, which is a major contributor, as it causes fluid overload, making your heart work harder. Everyday stress is another big one, as it can cause temporary spikes that add up over time. To get a clearer picture, consistent monitoring is our best tool. This means doing simple blood pressure checks at home, which helps us see the real-day pattern. We'll also continue with your routine blood and urine test here to monitor your kidney function directly, and we'll schedule more frequent clinic visits to make adjustments quickly. The foundation of all this is taking your medications exactly as prescribed, every day, because they work to protect your kidneys around the clock, even when you feel fine. This is how we'll work together to get your blood pressure under control.
All right, now I have a better understanding.
Mihiraa, let me just recap everything we've discussed today to make sure we're on the same page. First, we talked about how you've been feeling, and I want to reassure you that your feelings of fatigue and worry are completely valid. Our main focus is getting your blood pressure under control, because it is the single best thing we can do to protect your kidneys from further strain and to keep your heart healthy. To do that, we have a plan. We'll work together on your diet, focusing especially on reducing salt, watching your protein, and cutting back on processed foods. We'll also look at lifestyle changes like gentle exercise, stress management, and it's very important to avoid painkillers like ibuprofen. Mihiraa, you raised a great point about what might be causing the high readings, and we'll investigate that by ensuring your medication timing is consistent, monitoring your salt and fluid intake, and tracking your stress levels. This brings us to our action plan. You'll start checking your blood pressure at home regularly. You'll continue taking your medication exactly as prescribed, and we will see you here for more frequent checkups to monitor your progress and make any needed changes. How does that overall plan sound to you?
That sounds like a very clear and manageable plan, Hansi. Thank you for your support.
No worries, Mihiraa. Take care.